Good morning, good afternoon, and welcome to our expert talk. Today we're going to talk about your DSCSA Toolbox, specific focus on VRS, the verification and routing service, credentials, and interoperability. I'm going to be joined today with some of our partners. So we have Chris here. Chris is from Spherity, the Customer Success Manager located in Europe. Matt is here from Criterion Consulting, an expert in the DSCSA, and myself, I'm Mark Blacking from Movilitas.Cloud. Three companies. Why do we want to bring this webinar to you? Well, if you look at Spherity, Spherity really provides a platform called Caro, which is providing secure ATP verifications with trusted digital credentials. Criterion, Matt is really translating the DSCA rules, the law, into actionable compliance strategies and helping customers to make sure they're compliant with DSCSA. And Movilitas.Cloud provides a tool on the internet delivered as a software as a service to do serialization, track and trace, and give you access to the VRS environment. So today we'd like to go over the final countdown. Where are we today, October the 30th? Where are we actually with this legislation? Going to break down the challenges. So what are actually the things you need to do or should have in place today? Going to talk about how can you quickly get compliant, and then we move into the VRS part and hopefully explain to you how the VRS network or how this whole system actually works in practice. We're going to zoom in into an app that is available for you to do VRS for free, and we end up with Q&A. In this webinar, there is a Q&A session, so please go ahead. There is a Q&A session in this GoToWebinar where you can leave your questions, and at the end, we will actually try to address them to you. So let's move into the final countdown, the Drug Supply Chain Security Act, or the DSCSA. This actually started in 2013 already, and we're in 2025, so that is more than 10 years. 2015, product tracing, verification, ATPs, Authorized Trading Partners, and we highlighted verification using the product identifiers because that is already in place since 2018. 2023, that was the original end date for the DSCSA. That was actually the Enhanced Drug Distribution Security, or EDDS. Because the market wasn't fully ready, they actually gave a stabilization period of 1 year, and then actually they gave an exemption to certain trading partners. And to be exempt, you needed to have connections established, or at least you needed to have documented evidence that you did everything you could to have those connections set up. So it was not like most people think it was delayed again till 2025. No, if you were exempt, you had the reason to work on getting everything working correctly. And that was actually split by manufacturers, wholesalers, and dispensers, which made a lot of sense because the supply chain is going from the manufacturer to the distributor to the dispenser. So May 27 this year, manufacturers needed to be fully compliant. Wholesale distributors, that was in August, and a little less than a month from today, the dispensers with more than 26 full-time employees need to be compliant. The smaller ones have till the end of next year. But anything you like to add? Is everybody compliant that needs to be compliant?
Yeah, I would just add that in my experience, no, most dispensers that I personally would advise to be compliant with the law by this November, or by the end of this November, are not. About a third of the dispensers that I reach out to on behalf of my customers are prepared. The rest are, they either don't know what DSCSA is yet, or I'm literally reaching out to a nurse at a hospital who has never even thought about this or shouldn't even be responding to my emails. So really, there's a lot of work still to be done in the next month to get the dispenser side of things up to speed.
Okay. Maybe take a look at what EDDS really means for companies, and then Of course, when you read the DSC documentation that is available, I mean, you can spend the whole holiday enjoying yourselves with reading it, but we try to condense it here in a nutshell. So if you really make the supply chain very simple, we have manufacturers that serialize the products, deliver to distributors, who distribute it to dispensers, who give it finally to the patients. Reality is, of course, a little bit more complex, but what is important, there needs to be a TI and TS, transaction information, transaction statement, needs to be exchanged. People are familiar with the 3 Ts, but actually DSCSA will replace that with a TI and the TS in a document, and that is called an EPCIS file that needs to be actually exchanged in a secure, interoperable, and electronic manner. And email is not one of those. That is not interoperable. It's also not secure. When does this exchange need to happen? Every time when there is an ownership change. So if I sell a product to Matt, I need to provide him a file. If Matt sells it to Chris, he needs to provide a file. And that file should actually arrive before the goods physically arrive, because you're not allowed to accept the goods if you don't have that file. And even if you have the file, you need to make sure that the serial numbers in that file match the physical numbers that you actually received. And otherwise, you have an exception. Exceptions, it's a big topic in the market. There are exceptions that the file itself doesn't make any sense. It's missing information, cannot be read. But there is also the exceptions about the content of the file, like the serial numbers in there. And
right.
Say something about it?
Yeah, there's two types of exceptions that occur. Most commonly are really only defined as these two types. It's product no data or data no product. So meaning you received product, but you did not get the data for it, or you received data that you did not get product for. The product doesn't match the data that you sent, an overage or a shortage in units that you purchased, but either were overshipped or undershipped, those units that you purchased. Most commonly today, it's the product no data exception that occurs, which Mark was touching on. If I, as a distributor, purchase product from Mark and the product reaches me before the data does, I technically cannot take that, or legally cannot take that product into inventory. And I have two choices. I can either quarantine it and open an investigation into that product and ask Mark to respond to that investigation, or I can just turn the truck around and send it back to Mark and not pay for it. Right? And that's costly either way. Either your product sits in quarantine and it's not being shipped to your customers, your downstream customers or the dispensers and the patients that need the product, or you're having to accept a full return on a truck that cannot be accepted into inventory at your wholesaler, which is actually a pretty common scenario these days. I get 90-minute warnings from my customers, wholesalers, saying they received a truck, but there's no data. I have 90 minutes to respond, or they're going to turn it around, or they're going to put it into quarantine and then open a quarantine investigation on that product, a suspect product investigation, essentially, which comes with documentation and all sorts of effort in order to close out that investigation and get your product out of quarantine. So really, this is important, and not only is it important, but it can be costly if you don't manage this properly.
And besides the cost, there is also the patient. I mean, the patient is in need of the medicine, and you cannot deliver it because you haven't received the file. You get yourself in a very difficult situation. According to the law, I'm not allowed to distribute this product, but the patient needs it. So what do you do? And I mean, it's an interesting discussion that you sometimes hear, like some people say, yeah, well, I need to give it to the patient. Okay. What if the patient dies? Because you have given that. So there is a lot of discussions about how this is going to work. And nobody knows because the law is just in effect.
Yeah, exactly. And there are exceptions that can be argued, in particular with, life-saving, literally life-saving in this moment medicines that must be dispensed. And if you don't have the DSCSA data, right, there it can be documented and argued that it needed to be done for very critical reasons. But in many cases, that is not true, and you have to have the data to dispense the product, or even to take it into inventory before you can dispense the product.
So that is important. Another very important piece about this drawing is that we see data moving forward. Of course, products can be returned, and products are being returned. First of all, you need to check if the serial numbers that you get back are the ones that you actually sold to that particular company. But secondly, if you want to resell them again, you need to do a verification. And verification is another thing that you're required to do. You need to verify the product. But verification actually needs to be done with the actual manufacturer. So you need to go down to the manufacturer of the product to know, what is the status of the product. I know there is a lot of discussion about, that you can actually check that based on your TI information. Well, in the TI information, you can verify if that product was actually received by you and matches what you have. But you really need to verify it with the manufacturer if the manufacturer really put that product in the market. And the manufacturer is also the one that only knows the status of the product. So that is important. You need to be able to respond to trace requests, and that you do based on the TI information that you have and the TS information. So if they need to do an investigation how the product traveled through the supply chain, they need to ask the different parties, like, who did you bought it from? Who did you bought it from? Who did you bought it from? And all these records need to match. And if they don't match, there is another problem. So we know what needs to be done. We know that the timing is pretty much come to be compliant, and we do have a solution for that. So if you need to be ready, we do have a solution, Movilitas.Cloud, cloud-based system that you can register online. You can immediately use it. If you don't like it, you cancel it, and you don't pay anything if you cancel in the first month. After that, the contract is month by month. So it's something you can really try. If you look at the different things that the companies need to do, serialization and aggregation is needed by the manufacturers. One particular thing that is very important in the US is that you have aggregated trade items. The example I always use is a six-pack. You have a six-pack, every bottle has a number, the six-pack has a number. If you remove one bottle, then the six-pack doesn't exist anymore. That is the same for these type of products. So physically, you can still see the code, but if the package is opened or if there are products missing, then that code is useless. So you should not scan it anymore, because then it's wrong. Manufacturers need to respond to trace requests, to verification requests, and they need to be able to ship and generate an EPCIS file. Distributors need to receive. Nice thing is, of course, that when you receive, that you can immediately compare it with the content of the EPCIS. You need to ship and generate an EPCIS, and you need to do requests and responses, and the dispenser need to receive request verifications and respond to trace requests. Package is there, so that is something you can use immediately. And of course, if you need help from somebody with expertise in this market, Matt, can they call you? I think they can.
Yeah, absolutely, you can. Yeah, I do recommend having some sort of subject matter expert help you, either somebody internally or external resource, or working with a solution provider that provides that subject matter expertise for an implementation. These things can take quite a lot longer than you might expect them to, especially when you consider, vendor selection, contract negotiations, all of the things that need to take place before the kickoff of your actual implementation. And then when you consider the trade partner integration piece of this, you're not only reliant on your own resource and your own tools, but also your trade partners' resources and tools to be ready and available to integrate with you. So, start now. In particular, dispensers, you're kind of already out of time to do this. So please, if you haven't, reach out to somebody for help today and get yourself started, because, like I said, you're out of time.
makes sense. So let's move a little bit more into the verification component. There is a lot of talk about VRS, verification router service, but we also have the feeling there is a lot of unclarity about why is it called router service and how does it really work. And so the VRS system as such is not just one system. It's actually a system of systems, and 10 solution providers worked very hard over the last years to work together to build one stable system that allows companies to do verifications actually in less than a second. And that is very important because you like to have very quick answers. But there is also another piece that is very important, is that you probably don't know where to go with your verification request. Because if you have a product that you feel suspect or you're being asked to verify it, who do you call? Who do you contact? With VRS, you don't have to worry about it. You just scan it and the VRS routes it to the right company. So how does that work in practice? Well, the system works with what is called an LD, a lookup directory. And every VRS provider has its own lookup directory, and all these lookup directories should have the same records in there. So that is why they're synchronized. And we all work together to make sure that that is happening. First thing that needs to happen is a manufacturer, who is the responder, needs to actually register the GTINs that they are responsible for, that they own, and they register them in the lookup directory of the VRS provider, and that VRS provider then also has access to the serial numbers from that manufacturer. Every VRS provider also has an endpoint. That is actually the verification endpoint, and that is where the request is being sent to. So what is happening, the requester is using a VRS provider. They're scanning the product. When they scan the product, the VRS provider looks in the lookup directory and routes it. That is why it's called a VRS, routes it to the endpoint that has the answer to that one. The endpoint answers, and we provide the answer back to that one. And this is all happening at the moment on average in less than a second. So it's working pretty fast. So this is how it really works. Another thing that's important is that when we look at this schema, is that the people that are doing the request and the people that do the response often don't know each other. And DSCSA says only authorized trading partners are allowed to do requests, and only authorized trading partners are allowed to give a response. So how do you guarantee that? When you exchange EPCIS files, it's relatively simple because you're direct trading partners, you have contracts with each other, you know each other, so you know that you are allowed to deal with each other. When you do a request, how do you know that your manufacturer is actually authorized? And how do the manufacturer know that you're authorized? Well, typically that is done based on GLNs. GLNs are the global location numbers. And I think pretty much everybody knows that every authorized trading partner needs to have a GLN to comply with EPCIS, to comply with the DSCSA, because without a GLN, you cannot generate an EPCIS file. So how do you actually identify it? And that is a big issue because GLNs, you can just search them on the internet. So I can just act like I am somebody else. And how do you prevent it? Okay, you can argue, you can say, yeah, but you can have GLN whitelist and GLN blacklist, but still I can act like a big company and probably I'm allowed then to be entered. So also the VRS has a solution for that one, and that is called actually verifiable credentials. And I don't know, Matt, is there anything you'd like to add to this slide before I give the word to Chris? Or
No, I would just say that, not only are GLNs easily searchable, but GLNs are also easily made up, and anybody can just create a GLN. And in my experience, many dispensers have done that, and they are using those as their, organization identifiers, even though they're not registered with, the GS1 body that manages GLNs. And that can also create some complications in verifying who is actually making this request when the GLN that's on the request doesn't match what you might expect the GLN to be from that requester.
Yeah, and it's not allowed because GLNs are official numbers. Yeah. Chris, maybe you like to share your ideas how Spherity can solve this issue about how do you know who you're dealing with?
Sure, yeah, thanks, Mark. So because of the issues that Mark and Matt just highlighted with GLNs, about 5 years ago, the industry was looking for a better solution. And this is how the idea and the technology behind ATP credentials, Authorized Trading Partner credentials, was born. They are digital credentials that include not just a quick lookup of an FDA registry or a state board registry. There is some due diligence that goes within, so they are properly vetted credentials. And the providers like Spherity have collaborated with VRS providers to integrate that technology into a simple flow so that the automated lookups of both the product identifier information, but also the trading partner validity, all can happen within that around about 1 second time frame that Mark mentioned earlier. So it's like ping and gone, right? That's the kind of transactions we're talking about, and there's no way a manual system could vet the counterparties in electronic transactions like that. So what happens with credentials is when a product inquiry is sent into the VRS system, before it's getting really into the network, the VRS picks up the credential from the trading partner, the requester, like a dispenser or wholesaler, picks it up, attaches it to the inquiry message, sends it into the network like Mark explained, it's being looked up in the directory and routed to the correct manufacturer, who then responds. And if they have a credential, the responding VRS will again pick up that credential, attach it to the response message, and send it back to the requester. What this means is that both sides know that the other party is who they say they are. So they know, as long as the credential comes through as valid, they know that that trading partner has the correct authorizations with their governing regulatory bodies. But they also know that in that moment of the interaction, this is truly that party. Like we said, for example, GLNs can just be looked up in a directory. You don't know when it's being sent, who's actually sending it. You don't know whether it is the party that is listed by GS1 is actually sending it. With credentials, you do know it's the correct party having attached the message to that, the credential to that message. I think for an overview, that's what I would.
And I think what's important to know also is that the codes that you send, they're only valid for 5 minutes. So if somebody would take those numbers or is able to get access to it, they cannot misuse it, because after 5 minutes, they're completely useless. So that's important.
Correct. One point maybe to add to the due diligence that's happening to create those credentials, that is thoroughly standardized and third-party audited. So any solution provider who wants to provide that kind of vetting service would need to go through an independent audit first.
So another thing that might be interesting for the market, of course, you need to be compliant with all the things that we talked about, but especially when we talk about VRS, there's a free verification application available, and you can scan this QR code. Depending on the phone you use, it will actually route you to the App Store or to Google Play. You can download it, and then you get the application Movilitas DSCSA. The thing that is required, of course, you need to provide a GLN, an email, and a phone, because that is part of the standard from GS1, how you need to do a verification request. You're not allowed, we put it here, you're not allowed to put a GLN that is not yours. But yeah, it's not allowed to steal. And if people steal, they also don't permission. But to make sure that, because we're putting a free application, we have no control over the people that are actually using the app. And that is the reason why for this application, you actually need to use verifiable credentials. And through the app, you can actually request it. So you download the app, you request your credentials. If you don't already have them, Caro will actually respond to you very quickly with the credentials. They provide you with a code, you scan that code. You don't have to type all the crazy letters and numbers. You scan the code, they put in the system, you only do it once, and then you're ready to go. And you can start scanning, you can do verifications. Yeah? You want to try it out, you can download it. There is also an interesting article from Spherity about GLNs versus credentials. So we recommend reading that one also. Maybe the key takeaways from this one, because I was just checking, we're getting quite a lot of questions coming in. So I want to reserve some time to go over the questions also. And yeah, please keep putting them in. Some key takeaways. So first of all, the EDDS is active. It means distributors are not allowed to accept goods without an EPCIS that matches the physical delivery. That is the case today. We do know that companies are still accepting goods, but that actually means you're not in compliance. Am I exaggerating that, or?
Yeah, that is true. Yeah, and it technically goes in both directions, right? The product no data and data no product, right? If you receive a shipment that is short, you should technically be quarantining that shipment, especially if it's a controlled substance or even a high value product.
At least
you are not supposed to take that into inventory.
Product.
Yeah.
If you have data no product, and then at least you have the advantage that you don't have the product. So
well, I mean shortage in particular. So you can be in a data no product scenario where you still received product, just not all of it. Which again, with controlled substances, that's a risk. That's a liability for your entire supply chain and outside the supply chain. Anyway, go on, please.
If you talk about the dispensers, the next group in line, in 1 month, actually a little bit less than a month, because November 27 is the deadline. And there, at least we see that a lot of companies don't know too much about what is required there. Yeah? And that is a little bit of a concern. At least they have the advantage they don't have to ship products, so they only need to receive the files. But they at least need to be sure that that file exists. And I do know that some companies say, yeah, but my distributor takes care of that file for me. That's fine, but you stay responsible for that. And so make sure that you have something like that. With VRS, it is a technical solution to do verifications. As such, the law is not saying that you need to have a VRS. The law is saying that you need to do verifications. But you need to answer within 24 hours. So it is at least advisable, and there is a free solution available. So no reason to not do it. Yeah, and at least to our opinion, GLNs are not a secure way to identify an ATP or a state regulator. So OCI, the Open Credential Initiative, they provide credentials. Spherity has the practical implementation for that to check your identity in real time. And everybody knows the internet is great, but we also know that nowadays, how do you know that the person that you're talking to is the person that you think you're talking to? And we need to be aware of that. And also for these type of things, you want to be sure that everything works, because there are a lot of people with bad intentions. Otherwise, we wouldn't need DSCSA to begin with. Anything, Chris, Matt, you'd like to add before we move into the questions?
I would maybe add, because it's the first time you mentioned OCI, so just to explain that, as Mark explained, the VRS network, where half a dozen to a dozen providers have to interact, that's because all these VRS providers adhere to certain technical standards. And the same is true for credentialing providers. We adhere to certain technical standards, or at least guidelines, and OCI provides these guidelines that we adhere to ensure that interoperability and the smooth running of the network.
Yes. Thanks, Chris. Well, with that, I saw the questions coming in. Let me see. Okay. See, we have a lot of questions. Just a second to read some of those. I think we have here two questions that kind of look alike. One is saying, when we scan with your solution, we get error messages that the GTIN cannot be found. Why is that? Yeah, that one I can easily answer. There is another one that is a little bit the same, but let me answer this one first because it's a very short answer. Yeah, the reason why you get that, we talked about the lookup directory. So if you scan a product, we check in the lookup directory so that we know how to route it. When you scan a GTIN that we don't have in the lookup directory, then we cannot route it. So then we give you an error message to contact our support. And typically what we do then, we look up for you the manufacturer, the details, and we will actually provide you the detail. And hopefully we can even provide you an answer how you can contact them. And of course, we will talk with the manufacturers also if they got a lot of questions, that there is a better way of doing this. Yeah. And there is another question here, like, who's responsible for responding to verifications when the brand owner is using VRS, but the downstream trade partner is not? That sounds a question to you, Matt.
Yeah, you are. That's the short answer, right? So, like Mark said, they will look up a brand owner for the distributor or dispenser that's trying to make a request and then send an email. As a brand owner using VRS, you might have distributors or dispenser customers that are not using VRS, and so they will also send you an email. And this is one of the challenges with VRS today, is that not everybody is using it yet. And even some of the bigger players today are doing their verifications over email still. So even if you're using VRS, many of your customers might use it and you might have this as an automated process, but you will still receive email verification and you will still be responsible for responding to those verifications, because VRS is not a requirement, but the verification process is.
Great, thank you, Matt. There's here another question is, how long does it take till I get ATP credentials? I think we need to look at Spherity for that one.
Yeah, sure. It varies greatly. It depends on how well prepared the applicant or the trading partner is. So the super fast track is when the when someone in the company has a DEA signing certificate. So that's those people who deal with controlled substances, because then the process is or can be fully automated. It can be involve some manual steps. If there's no such, so normally these sort of DEA signing certificates, the downstream partners have them. It's rare for manufacturers to have some, but even for manufacturers, they should check if they apply for credentials. That's always the first check I would do internally, because it really speeds up the process. And And otherwise, if you have to go down the manual route, it would involve finding certain documents that prove that the company is indeed that company and that the person submitting the information is indeed that person before we get to the FDA registration or state board registration. And then if you're well prepared, this can be done quickly. Like it could be turned around in a day or a couple of days. It always depends on both sides how well prepared they are.
Okay. And that brings another question to me then also. On top of that is like, I went through this whole process, I get my ATP credentials, and now for whatever reason, my license is expired or taken away. Can I still use my ATP credentials then, or how does that work?
If we identify that the underlying evidence is not valid anymore, the credential will be revoked. Of course, with our partner, we will try and salvage that case. So as soon as it becomes apparent that there are some questions around the validity of the credential and the status of the company, we will be in touch with them. Because it might just be a misunderstanding, a late submission of some document to the state board or whatever, things can happen. But if it can't be salvaged, then yeah, the credential will be revoked and it will produce an error message in the VRS network. And then the
technically, when I scan, I will actually get an answer back like, we're not responding because we don't know who you are.
If it's set that way, I mean, that also depends on the VRS configurations. Some will let these responses or requests through regardless and do due diligence afterwards to figure out, okay, the credential wasn't valid, but because it's a fully automated system, so it could be that the manufacturer decides to still let it through, but then put some manual steps in after for verification. It could also be that the manufacturer says, nah, credentials are the only thing I trust, and they put a full-on barrier, and then the requester would never get a response through that path. Then you would need to find workarounds.
Okay, check. Just moving them over here. This is a typical question for Matt. What department and resource do you see most often responsible for DSCSA within an organization? Is that the nurse you were talking about?
Yeah, honestly, it's kind of all over the board. It really depends on the size of the organization. A lot of times I see, supply chain being responsible for DSCSA, but honestly, some of my clients are, there's 5 people that work at these companies, and I'm, taking this responsibility over from like literally the president of an organization. So who just was the only person that knew anything at all about DSCSA, and so they were the ones doing it until I offered to help. So realistically, you need to have some sort of DSCSA subject matter expert on staff wherever they land in the organization. Is it's kind of a dice roll most times. And again, it's really dependent on the size of your org. But supply chain most often. I've also seen IT, just because there's this software component of all of this, and technical integration component to all of this. So, but again, it depends on the size of your org. But certainly not a nurse. They have too many things going on.
Okay. That sounds good. Question here comes in: are VRS or ATP credentials required by law?
Oh.
I think I can. Yeah, I think I answered that a little bit earlier. That it's not required. I mean, verification is required by law. How you do it, that is not described. I think the only thing that is required is 24 hours.
Yep.
Uh,
I think this question might come up. I get this a lot, actually. And the I think, frankly, I think it's a bit of an oversell on the VRS module perspective from some providers of these VRS modules. They drill home that verifications are required, so VRS is required. VRS is just a tool to support the requirement for verifications within 24 hours because it gets it done quickly within half a second, like Mark mentioned earlier. But the actual tool VRS is not required. And it is also not required to verify every single item that comes in your door. We need to be clear on what the expectation is about receiving data to weigh your inventory or your receipt against versus actually running a verification request, which is a real thing and a separate requirement from the traceability data that you have to receive. What is required, though, is, and this isn't necessarily called out in a particular law, but what is required and what state regulators are looking for in the way of verifications is an SOP specific to your verification process. And that is, I've seen this a bunch of times already, as it is, where state auditors or state regulators are coming into pharmacy or at the distributor level, and they're looking for very specifically how they are managing verifications and trace requests, because it's a big piece of all of this, especially, and it is really the thing that's keeping the supply chain secure is tracing and verifications.
Sounds good. And that flows into the next, maybe you can pick that one also, is do I need to verify every product I receive?
No. Yeah, like I said, no, you don't. Not a specific verification request against every single product that comes in your door. No. Do you need to confirm that you do have the data for every single one of those products? Yes. Some pharmacies or dispensers have taken the route of or chosen the route of verifying at the top aggregate level. So, if it's a large distribution network or a large pharmacy or hospital group network that has its own distribution, they might be receiving full trucks and pallets worth of product to their distribution centers. And then they call that their DSCSA compliance by scanning the pallet and you're relying on that aggregate data to accept that pallet into inventory. I personally don't think that this is enough, especially at the pharmacy level, and would recommend that there is a one-to-one identification of product received, or at least counts at the lot level using the serial data that is also received for those products. But you do not need to do a specific verification request, which is something that is sent to an upstream trade partner for them to respond to. You do not need to do that for each product you receive.
Okay. Got time. We have 2 more minutes for some questions. Yeah, we are a manufacturer. Can the free app also be used for responding? Yeah, would be nice. You can use the free app for verification. You cannot use it for responding. I mean, of course, you need to have a little bit of bigger setup needed. We can do that very quickly. I mean, VRS for a manufacturer is, on our side at least, a matter of defining your GTINs, setting them up in the lookup directory, and then upload your serial numbers, which you can even do from an EPCIS file, and then you're ready. There is a cost. It's a small cost, but there is a cost. It cannot be completely for free. And then I think, Chris, we have time for one more question for you. It's an organization that consists of several entities, and will each one need an ATP credential?
In principle,
that's short answer to that one.
In principle, the short answer is no. They need one credential, like say the headquarter credential. How to decide it is down to the trading partner. We also can't advise. It would make sense to use the same entity that is also registered basically with the VRS. But there's other factors to consider. In the end, how do you want to show up with your credential in the network? How do you want to be recognized by the other trading partners is the basic question.
Okay. That makes sense. I'm moving to the last slide. First of all, thanks for joining. Yeah, there are some more questions that we will answer afterwards. So you will get an email. You will also get the presentation. We will answer those questions for you. Stop on for a second. Just getting an alarm there this time. So again, thanks for joining. Our details are here. If you have any questions afterwards, you want to talk further, feel free to contact one of us. And yeah, that ends. Thanks, Chris. Thanks, Matt. I think it was an interesting conversation. And
Yes.
thanks to the public for joining us. And
Yes,
hope
Thanks for
thank
having
you.
us.
see you soon. Thank you.
Thanks.